Hello, my name is Jeremiah Guzman, your student nurse for today. And to start me, I know what your name is,
My name is Rafael Banse.
right? And how would you like me to address you?
Rafael.
So, Mr. Rafael, for verification purposes only, may I know when is your birthday?
My birthday is on August 23, 2004.
So today, I'm going to be assessing your abdomen. I'm going to check if there are abnormalities or abnormal findings there to find volunteers to find. This requires me or require you to take off your shirt if that's okay with you.
It's okay.
Okay. For that, I'm going to close the privacy. I'm going to close the curtains for privacy. And I'm going to ask you a few questions. That's okay.
Okay.
Don't worry that every piece of information that will be given to me is strictly confidential. That both you and I, an attending physician, will only know about this. And to start the question, do you feel any stomach pains recently?
None.
In the past, have you went to the hospital because of your abdomen
No.
or had any surgeries done for it?
None.
Your family, can you recall any familial diseases like cancers?
Nothing.
Nothing. That's good. And in your everyday or on your daily basis, how many times do you eat?
About 2 to 3 times a day.
2 times a day. Okay, so now that I have all the questions that I need to be asked, I'm also going to finally ask you, have you taken your bowel or have you taken your urine?
Not yet.
So now I'm going to ask you prior to finally assessing your abdomen, I'm going to be asking you to go your power, so when it comes to procedure, every assessment will be accurate and you won't feel any discomfort as science.
Okay.
After that, after you remove all your bowels, I'm going to ask you to remove your clothes. And don't worry, I'm going to be adjusting the room temperature for your likings and for your comfort.
Okay.
So now that you have laid down on the bed, are you comfortable in that position?
Yeah.
Okay, so can you please rest your arms at the side, please? Okay, so to provide more accurate results when I'm inspecting your abdomen, I am going to place another pillow
Okay.
on the bed and for your abdomen to be relaxed. And as you can see right now, as I am observing your abdomen, it is symmetrical. Color is also good as there are no redness, no inflammation, no hypopigmentation, hyperpigmentation, there is no. And when it comes to skin integrity, which means if you have stretch marks, wounds, lesions, or any cuts, you do not have any of those, which is good. The symmetry of the stomach is there, the contour, and there are no masses or bulging of any organs as I can see right now. And as I can see also that you are respirating normally, you do not have this breathing, which is okay. Now that I'm done inspecting your abdomen and since everything is good, I'm not going to begin smoking it with status quo. Okay. Don't worry, I'm going to reward everything so that we will not feel this is difficult. Okay, now I'm going to instruct you just to breathe normally, okay? Okay, 1 minute has been passed and now I'm going to move to the next quadrant. As your abdomen possesses 4 quadrants, I'm going to do this 3 more times. Okay. I'm going to rewarm it again. Again. And for the last quadrant. that I have done auscultating and trying to hear your vowel sounds, I do hear that each quadrant has approximately 7 to 8 vowel sounds for each quadrant, which is normal. Now, I am going to be auscultating for two sounds. These are normal sounds. From the requirement, first. Going to do the same procedure, auscultating each quadrant 4 different times, and each quadrant how many times. Let's go. Now I'm going to move again to the number quadrant. The third quadrant. Moving on to the last quadrant. Okay, so now that we are done auscultating, or I'm done auscultating for Louis sounds in your abdomen, I did not hear any Louis sounds or
That's good.
that's good, that's really good. So I did not hear any. Just to recap on auscultating, I used the diaphragm and the bell. Diaphragm, I am doing is to auscultate your vowel sounds, and I do hear that you are normal active, that your vowel sounds are active, which is really good. And now when I use the bell, I am auscultating for blue sounds, and I did not hear any of those, which indicates that that your abdomen is full. Okay, so now I am going to begin percussing now your abdomen since I have done auscultating. Can you please move your voice a little bit? Okay, it's percussing. I'm going to check if there are abdominal sounds. Causing abdomen, that should hear dollars and deep resonance on the lungs and flat on the bones. Okay. So I do hear that there's emanating here, dullness here, and then resonance on your lungs and flatness on your ribs, which is good. I'm going to move on to the other quadrant since I have firstly percussed your right lower quadrant and upper left, right upper quadrant. Now on your left the quadrant. Okay, I do hear symmetry on the left and right quadrants, which means it's good. The sound elicited are all normal, meaning that no organs are large, no masses as well. So again, flatness on the bones, which is in the ribs, resonance on your lungs, dullness on both your organs, liver and spleen, and abdomen is detached. Okay, so now that I have done percussing your abdomen and everything is normal, I'm now going to proceed to assessing your fluid weight. This fluid weight, I want you to place your hand in the middle on your umbilical cord.
Here?
Yes, it's lowered. Now I'm going to check for your fluid weight. Right first. This side. You can put your hands inside. Based on the fluid test, everything is normal as you do not have any sinus or any fluids that is going to passing from your hand, because your hand is blocking it, so that if the wave is passing to your hand, that means it has a problem. And as you can see right now, based on the test, it doesn't indicate any. Okay, now that I have done percussing your abdomen and testing your fluid wave or shock wave, it's all normal, and I'm going to proceed in palpating it. And this requires me to touch your weight. Okay. going to first light touch it and inform me immediately if you feel any discomfort or pain. Did you feel anything? Okay, that's good. And as you can see, he did not have any muscle guarding or muscle guarding reflexes, which means it is normal because since you have also mentioned, since you also mentioned when I interviewed before that you did not have any surgeries, which is good that you did not have any muscle guarding. Next, I am going to depalpate it. First, it was manual, and next is by manual, which means using one hand and two hands. If you feel again any discomfort or pain, just refer me to the feel pain.
No.
Okay, I'm going to do this again, but with two hands. Okay, so based upon that, I did not firstly your liver and everything is not that palpable, which means it's good because it's not enlarged, which means I also have not touched any passes on your abdomen, which means there's no enlargement of all your organs, and all organs are in place intact. You do not also feel anything. Okay, so prior to percussing, or rather prior to palpating your liver, I'm going to percuss it. Okay? Okay. Please smooth your. Now I'm going to percuss it again. But here's my tape, so I have to mark it. It's okay with you. But don't worry, I'm going to remove it afterwards. Yeah, okay. So I should hear resonance to know. Okay, now I'm going to be percussing it from your right lower quadrant. Okay, so as to measure your liver, as a here eliminating to dullness, it should measure 6 to 12 centimeters. Right now, it is 7.5 centimeters big and 3 to 4 centimeters from your umbilical cord, which is really simply important. And it is 4 centimeters away from your umbilical cord, which means everything is normal, that your liver is not enlarged and it is not small, as it is exact. Okay, so now I'm going to be palpating your liver. If you feel any, when I'm palpating your liver, this is going to be palpation. And if you feel pain, suffer immediately. So you can breathe normally. Okay, did you feel any pain? No. That's good. Due to your liver, it is not enlarged, and based on percussion itself and the palpating, it is the size is normal, there's no enlargement, it's not small, and you do also not feel any pain, which means it is good. Okay, now after palpating your liver, I'm going to palpate your circulation on the left. And if you feel any discomfort or pain, inform me immediately, please rest your hands. Can you also please take a deep breath? deep breaths, you can inhale and exhale completely. Okay, please move to the side. I do feel palpable on the screen, but it's still normal because first it's not enlarged, but I do just turn you flat side to furtherly palpate your screen. But overall, your screen is generally good. It does not happen. Okay, so lastly, I am going to palpating now your kidneys. And I'm going to instruct you to inhale deeply and exhale deeply as well as like the ones that I'm doing on the hands. Okay, so my hand one. Ah, yeah, this one. Please inhale. Inhale again. I'm going to do this to the other side. Okay, can you please inhale and exhale with me? Okay, when I am palpating your kidneys, did you feel any pain? No. Right? And since you do not feel any pain, that is really good. And I did not palpate much of your kidneys, which means your kidneys are not palpable, which means good as there are no enlargements or what. And now I'm now going to be assisting you to please sit down. Down? Yes, sir. Sit upright, please. I'm now going to remove this cable. Okay, now since you're in the sitting position, did you have any discomfort so far? Right, now I'm going to please ask you to turn around. And to finally assess your, can you please face on here so that the cameras can see it. Now I'm going to directly blunt my fist on you. Don't worry, it should not be painful. But however, if you feel any pain, just inform me immediately, as I'm going to be testing your kidneys. Okay, again, you did not feel any pain, right?
Yes, I didn't think anything.
So when you directly blunt or twist your back or your leg up for the testing of your kidneys, your right kidney is much more palpable because your right kidney is much more present at your back compared to your left, which is normal. And since you did not feel any pain, that is, please turn around. Now I am going to be removing the testing. After I remove the tape, you can now put back your shirt. Okay. Okay, so just to summarize everything from inspecting or assessing your abdomen, upon inspection, there's a symmetry in the masses, there's no redness. The skin barrier, you do not have any stretch marks, you do not have any wounds, cuts, abrasions, or wax from hospital dating. Your skull sounds are more active from using the diaphragm. Approximately each quadrant has 8 to 7 sounds. And when using the bell, there's no really sounds in all quadrants, which is normal. Palpate you did not feel anything at all. I did not also feel any masses, protrusions or dislocations of your organs. No pain, right? No pain. And when I'm percussing you, the placements of all your organs are symmetrical from left, right? Or rather, the placement of your organs are intact. as all the sounds emitted from left and right are all symmetrical. Dullness of organs, stability for abdomen, and resonance on the lungs, flat on the bones, or the ribs. And I performed the fluid wave test. The fluid did not pass through the other side, which is good, as there's no shock wave is really significant finding. When I'm also assessing your liver, it is 7.5 centimeters centimeters and it's from umbilical cord, it's 4 centimeters, which is all normal. And it's really good that you have to pay this to your liver. It's not large and it's not small, and your spleen. It's not totally much palpable, but I do bring it to the flat side just for checklist purposes. And you also do not feel when I palpate your kidneys, spleen, and your liver. Or your kidneys, it's much more palpable at the back, specifically on the right side because it's more present at the back, like in the front or inferior. And it's not much palpable. It's not palpable left to the right, and then you do not feel a bit big. And overall, your assessment is normal. There's not much significant findings to take off. There to take note. However, I'm going to write everything down and report everything, every findings to the physician to see if there are any further evaluation that is needed to be conducted. Okay. Do you have any questions? That is good. So thank you for your cooperation, and you may now.
Thank you.